So welcome. I see many of our usual participants on the list, so that's great. So as we've been doing it in the last few weeks, we're going to try to take questions during the talks via the Zoom chat feature. And so I'll try to monitor that. We have 3 speakers who we've asked to speak for 15 minutes each. So that will leave a few minutes for questions right after each of the 3. And then if folks can stay after 1, we continue on with more questions. I also want to, before we formally get started, to welcome the newest formal member of our community, Nathan Seltzer, who is an incoming postdoc here at Berkeley. He just formally started this past week. He filed his dissertation in sociology at University of Wisconsin. His advisor is Jenna Nobles, who many of you know is from her time here, including when she herself was a postdoc here. So Nathan, do you want to say hello?
Hi, I'm happy and excited to be starting at Berkeley. Hopefully we'll actually be able to get to California at some point in the near future, but I'm really excited to be joining this research community. So.
Excellent. Well, welcome. We look forward to seeing you in person. So why don't we go ahead and get started then? And I should note to people that we are recording this. So if anyone has a problem with it, turn off your video at the very least. So our first speaker will be Kristen Harknett, who has been working on the SHIFT project with Danny Schneider. I don't know if Danny's with us today. I know that he's deep in childcare experiments right now, but let me turn it over to you, Kristen. Thank you.
Thanks a lot. Well, it's great to have this opportunity to share some of our rapid response work. As Will said, I co-direct the SHIFT project with Danny Schneider. I do not think Danny is here. The SHIFT project is a large-scale study of job conditions for workers in the retail and food service sector in the US. And this is an industry that's been especially hard hit by the coronavirus pandemic. Our project started in 2016 with a goal of learning about work conditions for service sector workers. And we have been especially interested in shedding light on the chronic uncertainty that workers face when their schedules are unstable and unpredictable. So that's really been our central focus. But now with the shock of the coronavirus outbreak, there are a set of pressing concerns that we have been turning our attention to, including paid sick leave and a number of other ways that workers are experiencing the shock of the outbreak. And I'll describe just the really vast variation that workers are experiencing and how we're going to try to track some of that using our ongoing data collection in our study. So this slide here shows a snapshot from just about a week ago of workers in Philadelphia in the service sector and what they were reporting. This comes from a daily text survey done by Anna Gaspin-Pines and Liz Ananot. And what they found was that only 29% of service sector workers were experiencing the status quo. The rest, 71%, had either been laid off permanently or temporarily or experienced hours reductions. So this is an enormous shock in the service sector. Another snapshot comes from administrative data from a workforce management company called Homebase. They reported on hours reductions experienced by service sector workers employed by small businesses across the country. And they found really massive reductions in hours. Since all these workers are paid by the hour, these shocks to hours directly translate into shocks to earnings. But not everybody in the service sector is having this same experience. There have been some subsectors of the service sector that have been experiencing a big surge in demand and have been deemed essential. So this includes grocery, delivery, pharmacy workers. These companies are actually currently hiring. And so the issues for these workers are quite different. They're encountering intensification of work and also intense exposure to risk of illness from the coronavirus. This is a really rapidly evolving landscape for workers and for companies. A number of companies have announced emergency measures like expanding their paid sick leave or giving some hazard pay or some cash bonuses to workers. So it's really dizzying and hard to keep track of everything that's unfolding. But what we know is that there's just a lot going on in the service sector. This is one of the ground zeros for the outbreak and the economic impacts of the outbreak. So the SHIFT project that Danny Schneider and I have been working on for the past 5 years is in a good position to inform and monitor what's going on for service sector workers. Our study, which I'll describe very briefly, collects national data from service sector workers at a large scale using surveys. And because we have large samples, we're able to characterize and gauge variation across large cities and large states. And one thing that's very unique about our study is that the service sector workers we survey are nested within large named companies, which gives us the ability to describe, compare, and contrast what's going on from one company to the next. The way that we have been collecting our data for the past 5 years is we take advantage of targeting capabilities on social media. Facebook and Instagram allow you to target survey recruitment ads to workers employed at particular companies. And we've been at this for years now, and this is the same approach we're currently taking. We're in the field right now collecting data from service sector workers. So we invite them to participate in our survey. If they agree, they're taken to an online survey, and they fill out information about their work schedules, demographics, economic security, health, parenting, and child care. We have a database of survey responses from about 100,000 workers at 120 large companies. Some examples of the companies represented in our data is shown here, and it spans the portion of the service sector that has experienced this surge, like the grocery and pharmacy and delivery sectors, as well as the portion of the service sector that's been hardest hit by store closures and furloughs, like retail apparel. We are currently in the field collecting our 8th wave of data. We have collected repeat cross-sections starting in 2016, twice a year, and we have a small embedded panel study where we follow up with the same workers to see how their conditions are changing over time. We have, with the information that we had already collected, one way that we've attempted to rapidly respond to the shifting landscape is to mine our data for information on having or lacking paid sick leave for workers at particular employers. And a few weeks back, as the coronavirus outbreak was heating up, Danny and I wrote an op-ed that we submitted to the New York Times, but at the same time they were already preparing their own op-ed that was very similar, but this led them to ask for, can you tell us company by company about who has and who lacks paid sick leave? And so we were able to provide that information, and it got published in the New York Times op-ed. On the left of this slide, it's an excerpt of some of that information where we show the share of workers company by company that lack access to paid sick leave, and then we also estimate the number of workers for each company who lack paid sick leave. We did this very rapidly to get the information out there. We followed up by publishing a research brief so that anybody interested in more details can access that information on our SHIFT project website. We also, with the help of some fantastic people at Institute for Research on Labor and Employment, Anna Fox Hedges put up this nice data visualization where you can search by company and get the information on workers who lack paid sick leave. Next week, we'll be publishing something a bit more expansive on paid sick leave for the Irvine Foundation. So that's some of what we've been able to contribute with the information in hand. We've also been trying to rapidly pivot to make sure that the information we're collecting continues to be relevant and the most valuable information we can be asking service sector workers about right now. Literally, I think 2 days before we went into the field for our spring data collection, it occurred to Danny that we should include a question on coronavirus. And this is before shelter in place and everything started happening. So lots of credit to him for his foresight in this. But the data that we've been collecting this wave includes this question that we cobbled together over the weekend before we began fielding our survey. One of the nice things about our survey is we are in a position to rapidly respond as conditions change, and that capacity is really being tested right now. But our current data collection includes this question that asks workers to report on how their workplace has responded, either by reducing hours, closing, expanding leave, and perhaps taking some enhanced safety measures. Just last weekend, we made another adjustment to our current data collection. In normal times, we had only been interested in collecting data from workers who were currently employed. But now, with huge portions of the service sector workforce on furlough or laid off, we were going to be missing a huge chunk of workers. And so we last weekend revised our survey so we would be capturing information from laid off and furloughed workers. And we added this question with the help of Jesse Rothstein on applying for and receiving unemployment insurance benefits. So we're currently collecting this information to get some information on whether workers are able to access this crucial benefit. Our future plans. So we will continue to collect data for our spring wave over the next 3 months. We got some rapid response grants from the Gates Foundation to expand our current data collection so we can gather a second snapshot from 35 large companies later this spring, so we can see how conditions compare early spring to late spring for some of the large employers in the service sector. We also have plans in place to follow up with an occupational cohort who we first surveyed in 2019. And this gives us the opportunity to go back and see, for people who were employed in the service sector in 2019, where are they now, in the midst or hopefully starting to be post-coronavirus outbreak. And so our follow-up with this occupational cohort will gather information on a few relevant COVID-19 topics. So we'll gather more detailed information on how employers are responding, and we'll be able to do this comparing and contrasting across particular employers to show what they have or haven't done to respond. We have been collecting data on paid sick leave, but we're planning to enhance what we collect, and especially adding information on the medical documentation requirements for accessing paid sick leave, because some people who have paid sick leave can't use it if the requirements are too onerous. We will also gather more information on safety net access and whether workers have gone through the experience of coronavirus diagnosis or symptoms, or whether anyone in their household has. In addition, and I know I've got about 2 minutes left, I think, here, we are also planning to follow up with workers on their economic conditions, because this has been both a health and an economic shock. So we have baseline information from 2019 from this occupational cohort on their household economic security, health, and well-being, and we'll collect that information again in the summer and in the fall to see how that has changed for workers and their families. We are also going to be merging information on store closures. In our data collection, we ask workers to report on their store number, which allows us to get great specificity exactly where they've been working. And we're purchasing some external data on store closures that we can merge with our survey data to then be able to model an economic shock at the establishment level. And so those are some of our plans with the occupational cohort. I want to make sure I leave plenty of time for the other presenters who I'm looking forward to hearing from. But there's a lot of plans afoot from the SHIFT project, and we'll have a lot more to say on all these topics later this year. I'll end by thanking our project staff and the graduate students and the funders who've supported this project. And thanks again to the Berkeley Brown Bag series for this opportunity.
Thank you, Kristen. That was fabulous. It's amazing what you're able to do already with the existing data and what you've been able to do so nimbly. So there are a bunch of questions in the chat, so I'll sort of read them out. We have a couple minutes for you to try to quickly respond. So first of all, can you characterize, do you have ways of characterizing more about the financial situation of the workers and how they're paying rent and putting food on the table, et cetera?
Yeah, well, the one thing that we can do with the data we already had in hand, we can describe just how very close all these workers were to a financial cliff. Somewhere around half of the workers in normal times, pre-outbreak, say that they don't have the capacity to deal with a $400 expense shock. And the vast majority of workers are experiencing a shock of much greater magnitude right now. So we know workers are very financially precarious. We don't yet have information from our current wave on the added hardships, but even during good times, we're seeing very high reports of housing and hunger hardships among these workers. So they're very vulnerable.
Yeah, great. Josh had a follow-up about that, about how much the $1,200 checks might contribute to that. So I think that would be interesting to this follow-up. There were a couple of questions about health insurance and what you know about health insurance coverage and what's happening to the people who are laid off in terms of their health insurance.
Yeah, that's a great question. Our survey does have information on whether workers have health insurance and whether it's employer provided. And in our follow-up survey, or I'm sorry, rather in our current survey, in the recent round of tweaks, for the laid off and the furloughed workers, particularly the furloughed workers, we made a revision so we would capture whether they've been able to keep their benefits. And specifically, if they say they had health insurance through their employer, we will know whether they were able to keep that during their furlough period or whether they've lost it.
Good. So there are a few other questions I think we'll have to postpone until the Q&A at the very end. But just one final question quickly. I know that sharing these types of data are really hard. Are there opportunities if students or others want to be able to help analyze these data and publish more things from them?
Yeah, definitely. We've got a lot of graduate students who are working on the project right now. And I should have included my email address up here, but I hope that's easy to find. So please do reach out to us if you're interested in getting involved. A couple of UCSF graduate students are piggybacking on some of the efforts we've done to collect in-depth interview data, and they're following up with some of these vulnerable workers over the next couple of months, and that's been initiated by those graduate students. So we're always happy to hear from people who can help us expand our capacity.
Fabulous. All right. Thank you so much, Kristen. So a virtual applause for you. And
thanks, Phil.
We'll have more time for Q&A at 1 o'clock, but I want to have plenty of time for our other two presenters who are also piggybacking on ongoing projects that they have to try to understand more about the effects of COVID-19 on vulnerable populations. And so both of these next two projects, the Pop Center has been able to give some startup grants to help them move forward quickly on as they start to collect new data. So our next presenter is Julie Deardorff from the School of Public Health at UC Berkeley. So Julie, I think you're going to share your screen. There we go.
Great.
I see it. Oops. Yes. So
back to the beginning.
Yeah.
Okay.
All right, there we go. Thank you, Julie.
Great. So thanks for this opportunity, Kristen. Your work is fascinating, and I think I have a lot to learn from it because we're dealing with a very special population of workers, specifically farm workers and other workers in Salinas, California. And so I'll talk a little bit about that. This is the result of a long ongoing cohort study that Brenda Eskenazi started about 20 years ago. And so I'm going to spend a little more time than Kristen did just kind of describing the study so you can see how we're positioned. And part of why we haven't been able to get anything out into the field yet regarding COVID-19 is that our study, like most studies that involve human subject research, it has stopped. And so we're trying to pivot right now in order to be able to survey our participants using other methods and specifically other technologies, which works pretty well with our younger participants, but we also have folks who are less comfortable using technology. And so that's part of why we reached out to Will for the pilot grant. So let me tell you a little bit about what we're doing. Our work takes place, just to situate this, in Salinas, California. Salinas is also known as the salad bowl of the nation. It provides a large amount of the salad vegetables, broccoli, strawberries that the nation consumes. It's the birthplace of John Steinbeck. It's miles from the prosperous Monterey coast, but it suffers from a lot of economic problems and youth violence and various other issues. It has a rich history of farm worker advocacy, very strong union, farm worker rights, and at every level, the agricultural industry is infused in what's going on in Salinas, California, and the surrounding areas. Salinas itself is not a large city, but it has big city problems. It is generally about 75% Latino, mostly Mexican. 31% of, I'm gonna just make sure I'm timing myself, 31% of folks live below the poverty level. Half of students are on subsidized lunch. A third don't graduate high school. There's a very high teen pregnancy rate that's identified as one of the bigger problems by the medical community in the area. And it is one of the highest risk communities nationally for youth gang violence, and was identified during the Obama administration as one of 6 high-risk communities. And so that includes places like Chicago, Detroit, Oakland, etc., LA. So some of the questions that we have right now, given the COVID-19, and I'm having trouble seeing my screen, so I'm going to move things over, is how is our sample, and I'll tell you a little bit more about it, faring, given that they're living and working in an agricultural area, and how are they responding in terms of the COVID-19 prevention measures that are being taken? Has the pandemic affected folks' mental health, access to health care, and job security? And a lot of the things that Kristen is trying to find out, we're trying to assess in this community. So our farm workers and other low-wage workers in this area being afforded appropriate workplace protections, our concerns about job security causing individuals to work when they're sick. Do they have fears about citizenship status that augment their job concerns, mental health issues, and access to care? The study that Brenda Eskenazi started 20 years ago in this area is called CHAMACOS, the Center for Health Assessment of Mothers and Children of Salinas. And it was originally started to assess pesticide exposure and other chemical exposure on the neurodevelopment of young children. And so Brenda recruited 601 pregnant women between 1999 and 2000 from clinics, from local clinics. And of these, you can see that demographically, the majority spoke Spanish, and most were born out of the country and most in Mexico, and had spent very few years in the United States. Most were living in poverty and had a 6th grade education or less at about 44%. Many of the women themselves who were pregnant worked in agriculture, but 84% had a farm worker living in their household. There was substantial attrition in this data set. Between 0 and 3, people moved back to Mexico, they moved to other areas, but there is a fairly stable farm work employment year-round in Salinas and in neighboring areas. So after the first few years, we had a stable population of participants who were living in the area and stayed in the area. But in order to have adequate sample size by the time the children were age 9, a second cohort was recruited that was demographically similar to the participants and about the same size, about 300 people. And so the same measures have been in place for both of the cohorts since age 9 to now. And the youth range from about 18 to 20 right now. So we have about 600 parent-youth dyads in the sample. And just to let you know where we were back in the field at age 18 collecting data when folks were ordered to shelter in place and we had to cease human subjects research. So we had surveyed about 400 of our participants, both mothers and youth, and they're young adult youth at this stage. And we still had about 200 that we haven't been able to reach at this point. This just gives you a sense of the timeline of this study and the various time points at which we have brought people into our field office. Our field office is located on the Natividad Medical Center campus, which makes it very accessible to our families. We provide transportation to that site. And for the folks who live further out in the fields or in agricultural areas that surround Salinas, they're also able to do a lot of their errands when they come in to visit. And so since this study has been kind of predicated on providing a safe space to do all of these visits and collect data, it's a big shift for us to think about trying to survey these participants using different types of technologies, although we have played around with that a little bit with the young adult population and have achieved some success. This is just to let you know the scope of the study because it allows us as we pivot to draw on a lot of data that we've been collecting at all the time points that I showed you before. And in large part for the purposes of the work that we want to do here, we have tons of employment data and over time, but we also have, you can see in the far right-hand bottom corner, behavioral health and psychosocial measures for both the mothers and the youth. And that's a focus of some of the work that we're doing now because we're very interested, not just in what's happening in terms of their homes and workplaces, but how this is affecting the mental health, healthcare access of these families. We also have a lot of other data, including urine, blood, breast milk. We have saliva for cortisol and a variety of other things and genetic data. And so lots of biosamples banked and home assessments. So we have information over time about the quality of families' homes, which is very relevant to the current crisis because if families have a lot of household crowding and family members who get sick, there's not often many options for how to quarantine people or keep other family members safe. In addition, some of our families don't have running water in the home or they have shared water sources. And so that also raises some issues when we're talking about preventative measures for COVID-19 or even the treatment of the illness if people become ill. We've done a lot of work on fear of deportation and immigration policy concerns in this sample. We don't ask about citizenship status, but we have a good sense of who was born here and who wasn't. And we do ask about fear of deportation or immigration policy concerns for you or your family so that we're not identifying people specifically as US citizens or otherwise. And we have found that particularly with the most recent administration, mental health issues have gone up in this population given the negative rhetoric around immigration policy. So we recently had a paper published in JAMA Peds showing that mental health of our youth had changed from 14 to 16 with the initiation of the Trump administration, and that there were higher levels of anxiety and depression and sleep problems in the sample. And we've also shown cardiovascular risk increases for mothers in terms of fear of deportation. And the reason I mention this is because it really can serve as a barrier for these families in terms of accessing appropriate health care if they need it in the middle of the COVID-19 pandemic, and also in terms of being able to access their rights as workers, and to ensure that they can stay home when they're sick, and as we know, they're not eligible for the stimulus money that would be coming from the federal government. So there's big implications in terms of status. We have multiple mental health measures, and I'm just talking about the most recent ones for the mothers and youth. So we have looked at depression and anxiety for the youth, and mom's depression and anxiety at ages 14, 16, and 18 for the youth. And as I said, we're now in the middle of our 18-year visit. And so we have a unique opportunity to see if mental health is changing during this period and what that might be related to. And so what we've been doing since we applied for the pilot grant funding is we have been preparing questionnaires that we're hoping to administer using Qualtrics links for what people are facing now at this point in time. And for many of the moms, we expect that we'll have to interview them by phone because we're not sure if they'll be able to use their smartphones, et cetera, to access our surveys. But we are hoping to push them out at least to the families that we were able to consent already at age 18. And so the types of questions that we're putting into this survey ask about loneliness and crowding and social isolation, internet connectivity for both the adults and the youth in the household. We're asking them if they know about appropriate work protections. Some places we know they've been implemented and some they haven't, and only recently have many of the appropriate materials been translated into Spanish. We're asking if they have gloves and masks and hand washing stations, et cetera, and if they are able to socially distance, even if they're being told to do so. We're also curious about how people are getting to work. Many of the people who work in agriculture have to take farm buses, or they have to carpool, or they're taking trucks to work where it's impossible to socially distance. And we're curious about how crowded these transportation methods are. And as I mentioned, fears of deportation or potential job loss potentially augment these mental health issues. So we are asking about these kinds of concerns, including job security. And one of the items we just recently put in, given some of the press that this issue is receiving right now, is about these workers now, not only farm workers, but also people who work in low-wage settings, how their jobs are suddenly becoming essential when for so many years they've kind of been ignored. And so we're getting mixed reactions to this, and I find that interesting that some people feel proud that they're essential, but there's a lot of frustration and anger as well. So as of yesterday, there were only 63 known cases in Salinas and 2 deaths, mostly among Latinos. And we know that the situation is going to be dramatically different over the next months. And like I said, only in the past week have we even seen appropriate COVID-19 information being distributed in Spanish and other dialects and languages. And so the Pop Sciences seed funding is going to help us track some of these issues over time. So even though we're doing kind of a quick and dirty survey right now, our hope and what we plan to do using the money that Pop Sciences has provided is to conduct 2 to 4 focus groups this summer with mothers and young adult children to better understand how COVID-19 has impacted their lives, kind of do a deeper dive and hear from people on the ground. And our goal is to do these in Spanish and English by Zoom. And we may separate out mothers and young adults. And so that's why I think we'll probably have 4 focus groups ultimately. And then we intend to compile the qualitative data and develop stronger scales, because Like Kristen was mentioning, I think we're kind of pulling these items off the shelf. We're making some of them up. There are some national surveys, but they don't always work well with our farm worker population. So developing stronger scales for future quantitative assessment in this sample and similar samples is one of our goals. And especially with this focus on stress and mental health, I think there's different stressors, and different mental health issues can come out of the unique stressors that are being faced in this community. So we have the opportunity to add the new scales to the remaining interviews when those get reinstituted in person with the 200 parents and youth when we're back in the field. In the meantime, though, we're hoping to gather as much information as we can, as I mentioned, using different technologies. And then the intent is to apply for some funding, either a small R or an administrative supplement, to go back and survey the entire sample in fall, winter, or spring, once we know what the longer term effects of COVID are on this community. And so I finished a little early. I was talking fast. I know that we have limited time, but I wanted to thank the Pop Sciences Center for the seed funding, and actually earlier Pop Sciences funding allowed me to get some preliminary data to write my R01 that funded the 14 and 16-year-old visits in this sample. So I'm offering appreciation now and for the funding before that made this possible. And thanks to Brenda, who started this and had a lot of foresight to gather a lot of adversity and mental health measures early on, even though what she was studying was environmental epidemiology. And to our funders, and I'm not quite done. Let me see if I can keep moving this through.
So I want to make sure that we still have 15 minutes for Lia. So.
Okay, that's fine. I have 50 seconds left. I've been timing myself. Okay, but thank you to everybody. I'm happy to take questions now or later.
Thank you, Julie. That's
Sure.
terrific. If we can hold off until 1 o'clock, and then we'll have questions for you. Although I do want to just take the prerogative for one quick question. I've seen lots of different questionnaires floating around on these different topics, and there's a Johns Hopkins group that's trying to harmonize some of the mental health questionnaires. So, are you open to actually some crowdsourcing on your questionnaires? And
yes, that would be great. We've actually looked through many questionnaires as well. But if people have great ideas that would work in a community like this one, we'd be happy to. And we still have not submitted this to IRB, so the sooner the better.
So if people have suggestions or want to help, they should just contact you.
Yes, and okay. And we have opportunities for students to work on these data too. We now have actual data sharing forms you can fill out if you're interested in looking at some questions in these data.
Fabulous. Thank you so much, Julie. This is terrific. And so Lia Fernald is our third speaker today. So yes. Again, she's talking about some rapidly piggybacking on some existing work. So take it away. Thank you, Lia.
Hi, thank you so much for this opportunity. And I will tell you a little bit about, this is an add-on, exactly as Will said. This is an add-on to an existing study. I first want to acknowledge that my two co-PIs are on the call too, Wendy Gosleiner and Rita Hamad. And so we can, hopefully they will be able to chime in and or participate in the discussion afterwards. So we have a parent study that's funded by the Robert Wood Johnson Foundation. And the goals of the parent study are to understand awareness, barriers to uptake, and benefits of participation in the EITC among California parents of kids less than 0 to 5. And just very briefly, the EITC provides tax refunds to low-income working families. It's the largest poverty alleviation in California, program in California. The amount that families get depends on income and number of children. And there's a vast literature, well, maybe not vast, there are some studies about the benefits of EITC for families, that it reduces poverty, increases employment, improves access to housing, and that there's benefits to child and adult health. And this can provide up to $10,000 annually for qualifying families in California. And surprisingly, even though there have been clear benefits shown and the amount can be really substantial, 20% of eligible families don't receive the benefits. And this could be because it's confusing, because they have trouble filling in the forms, because they don't know about it. And the goal of our original study was really to understand this. The methods are that we were looking in 3 different counties, Alameda, Merced, Los Angeles, and we're exploring talking with parents who have and who have not used the EITC. And the goal really is to understand among the parents who have received it, what do they use it for? And for the parents who haven't used it or received it, what are the reasons and the barriers to take up? And we have two phases to the current study. One is a qualitative phase in which we had planned to do focus groups, but we are now transitioning to doing interviews. And the quantitative phase in which we would take questions that were developed during the focus groups and transition them into a quantitative assessment of 500 families in each of those different counties. The demographic characteristics of the counties, we selected these particular counties because of the ways that questions we were interested in. First, we wanted to oversample Latinx families and African-American families. So we're planning to oversample from Los Angeles and Merced. I don't know if you can see my mouse, but the Latinx families from Los Angeles and Merced, and then the African-American families in Alameda. We also selected counties that did have a large percentage of the population living below the poverty line. And we were also trying to be strategic in terms of thinking about places where we had contacts and would be able to then find the kinds of folks that we were looking for in terms of study participants. The original project timeline, which we are sticking to and basically using the Pop Center funding to add to, is that we have been developing interview guides and are planning to host interviews in the next month or two. Then we would convert these interviews into questionnaire and survey, figure out the logistics for collecting survey data and analyze the data, and then have our reporting and finalizing of the study over the next year. At least this is the timeline that we have for the RWJ study. And our hope is that the Pop Center funding is really allowing us to leverage the work that we've already done on this study and then add questions and about COVID-19 response. So just about, I share the same issue that Julie mentioned about human subjects. We had our original study approved, and it's also been approved by the California State Health and Human Services, which was required for us to work with WIC and other social services to help us recruit participants. Our CPHS amendment is under review at CPHS, and also at the California State amendment is being prepared. So we're ready to move forward with interviews just as soon as our amendment is approved. And CPHS has promised us that they should give us a response relatively soon. We have recruited a community advisory board at a statewide level with the California Association of Food Banks, the director of the United Way, at Golden State Opportunities, and then at the county level, we have contacts there too. So in Alameda, we have the Alameda Social Services and County Public Health Department, Verse 5. You can see on the list on the screen. In LA, we have the WIC program and the Maternal and Child Health Access, and we have our advisors from the RWJ Foundation, grant to Hillary Hoynes and Irene Yen. So our current activities, these are example questions from the EITC interviews, and they really revolve around asking this question of, have you heard of this? Have you applied? If you have, what's your experience? If you didn't receive the EITC, if you did receive it, how did you use it? Those kinds of questions. And our original phase is this qualitative questions. Original sample was for 60 individuals for focus groups. Like I said, we've shifted to interviews and are planning to test out whether Zoom is feasible or whether telephone calls will be more feasible. We also have a family information form in this first phase that we would collect some demographic characteristics, tax filing status, again, because the original study is about the EITC, employment status, education, and then information about participation in federal and state programs. So here's the planned add-on. So I apologize for rushing through that. I really want to make sure to have a chance to get feedback from this group, because I would love to hear ideas of other things that we can include. Our planned add-on for this COVID-19 study that was funded by the Pop Center is to conduct 20 additional interviews in each county, to oversample African-American in Alameda and Latinx in LA and Merced. There's some really disturbing results coming out of cities about death rates in African-Americans being much higher, disproportionately higher from COVID-19 than other racial ethnic groups. So that is a really concerning trend, and it's going to be really important for us to oversample African-American population. We have data planned for data collection in partnership with agencies such as WIC, Head Start, We will do our interviews in English and Spanish via Zoom or telephone. Part of our first phase is just really figuring out what's going to be possible. We plan to record the data, transcribe the data, and then use deduce to analyze. And then these findings would inform additional questions for a larger survey. So here is some questions from the interview form that we submitted to CPHS. And again, we're really open to talking about how best to word these, what other topics we could cover. But for example, we have 3 big categories. One is daily life and children, which are these questions. Then we have questions about finances, and then we have questions about health. So the first set of questions is really, how has this changed your daily life? How has this crisis changed your daily life? Specifically, how relating to schools and childcare, these facilities are closed. How has this impacted your family? And how have you provided care for your children during this time? And then if your school is closed, have you continued to receive school meals or any kind of meals during this time? Whether they have any awareness about the kind of pandemic SNAP program that's providing EBT benefits. And if you have become eligible for other federal programs, have you applied for them? Essentially, these questions are really around in this category of daily life and childcare. The second category of questions are these questions about financial effects and government support. So this is really what your experience has been with federal programs, and then how the COVID-19 prevention strategies affected your family's ability to afford food, clothing, shelter, and other needs. So some of these issues came up when we were talking in Kristen's questions too. And then how are you managing your resources during this difficult time? Then we have a few questions about the intersection kind of the taxes and whether you'll be filing or not, but there's no requirement to have filed taxes. We are also just asking those questions to understand what families have taken advantage of those. You might be asking yourself about the kind of people we would recruit for EITC would be different than people who are not eligible for EITC, because it does require that you prepare taxes. And so what we are hoping to do is to recruit people who are eligible for the EITC, and also those who are also low income, eligible, and have taken up or not taken up EITC. And then this third category is about health and healthcare. So can you talk about the effects of COVID-19 mitigation strategies on your physical and mental health? And then have you looked for support outside your home? Do you participate in any federal health programs? Have you had any difficulties receiving medical care during this time? And then if there's ways, what are the ways that your experiences during this time of the COVID-19 pandemic, how would those be different from your normal experiences with healthcare? I'm trying to keep track of the time, but I can't see it on my screen. Okay, so our next steps are to incorporate selected COVID-19 questions into a larger survey planned for the summer and fall. So that means we would use our qualitative data to then develop questions that really seem to have worked and capture a lot of variation into the larger survey. Our current plan is to survey 150 from Merced in LA and 200. We did get an additional grant from the Tipping Point to increase our sample in Alameda specifically. And so we can have a bigger sample size in that population, in that group. And then our hope is to use findings from the interview to apply for additional extramural funding to launch a larger statewide or national survey about the effects of COVID-19 mitigating strategies. And this question about sample size relates to the questions I have for discussion that we would love feedback on, which has to do with sample recruitment. If there's other ideas, I know Leora has given us an idea about how we could use some phone intercept technology that might help us increase our sample size. The content of interviews, is there something we're missing? We'd love feedback on that. We are planning to expand our age range of children with families, because the EITC study was really just for families 0 to 5. We're thinking that we should increase up to 5th grade. So essentially like 9 or 10, maybe 11 years old. So that is our plan, because I do think probably the school closures are going to have different effects across child age. And then we would really be open to other feedback since we're just at the very beginning stages of the study. And thank you. And please let's, I hope that Wendy and Rita, if there's anything you'd like to add.
That was a great summary.
Okay. All right. Well, should I look at the chat? Okay. Should we, Will, do you want me to look at the chat?
Yeah,
and
I want
answer some questions?
Thank you.
Okay.
That was great. It sounds like you're very much looking for feedback from people. So folks should feel free to reach out to you separately after this.
Yeah.
But there's a general question from Josh for both you and Julie. So how are you dealing with rapidly evolving changes in policy in this situation? So your research time horizon is many months, but what kinds of questions are evergreen and will be useful no matter what happens? What are you worried about will change before you get to the field or can analyze your results?
I mean, that's a really great, Julie, do you want to go first since you presented first?
Well, I mean, just briefly, that's constantly on our minds because we're right, especially in Salinas, we're right at the beginning of people even understanding COVID-19 and some of the with the people we're working with. So that was part of why we wanted to push something out quickly that might be relevant right now, but we're also trying to include the measures that are evergreen, like the mental health measures and the health access measures and things that we've been asking for many years in, embedded and and then we can assess change over time. But that's part of why the Pop Sciences grant is so valuable to us because it allows us to kind of take a moment this summer and ask people what's relevant to them now so that we can develop new questions that may be relevant down the road.
Good.
Yeah, I would say, I would just echo that's exactly how we're feeling, which is there is going to be a subset of questions that are evergreen. And then we also will have to react to, for example, the stimulus package and the fact that the $1,200 and all of these kinds of evolving responses, that will be we're going to have to capture that as we go along. I don't think we can anticipate it, and I don't think it's going to stop us collecting our data. Our hope is, in our case, that we're going to use this time in the next couple of months to look at the focus groups and analyze those data, and then be able to do our best that we can with our survey, and then hopefully be able to look farther down the road.
And then the reality is right now we're dealing with responses to prevention strategies, but we're going to be dealing with responses to illness later, and that's going to change.
Right, absolutely. That's a great point, Julie.
Yeah. So I want to just pause the Q&A for a second because we've reached our 1 o'clock endpoint, and I want to encourage people to stay on and continue with Q&A if they can. But before others that have to leave take off, I just want to give you a virtual applause and thank you for these terrific presentations.
No, you have to use the clappy.
Yes, I see a bunch of clappers up there. That's great. So this is really exciting, and so as people have ideas, they should reach out to you guys. And I know there are other similar projects going on, so I'm hoping that we'll get more coordination across different projects as well.
And just to answer one question, yes, we should expanding all the government stimulus
yes.
to undocumented population.
There's a question that says, do you believe that EITC should be expanded to undocumented? And absolutely, yes.
And everything that we're seeing in the stimulus package. I mean, if we're going to label workers as essential, then we need to also compensate them for their losses.
Yeah, there's another question in the chat above that. So will your projects collect data on low-wage workers' knowledge of what they should do if they have COVID-19 symptoms? So I wonder how well workplaces are acting as conduits for information to populations who might have less knowledge about the virus and medical resources available. Kristen, that may be particularly germane to what you've collected so far. You're muted.
Apologies. We don't currently have any questions about knowledge. We've toyed with adding that, and we'll continue to think about it. And I think that the insight that workplaces may be a conduit may elevate this to a level where we'd want to ask about it. Whenever we're adding things to our survey, we're always asking, is this the right mechanism for getting this information? And there are some epidemiological questions that our survey isn't the best one to address, but things that are related to particular workplaces, like workplaces providing or not provide or providing misinformation, could be a nice angle. So as we do a bigger revamp of our survey for the summer and fall, those are some of the kinds of things that we'll be working through. So we'd welcome further ideas. Thanks for that.
Great.
I think that's a great point. I just wanted to say that's a really interesting question that we could also think about in ours, to ask how what information they're getting from employers and how that then relates to access to healthcare.
Yeah, and we're trying to do
comment.
that, and we have some information from what's happening in Monterey County. To your point, Kristen, so we're getting information in real time as they're rolling out more information. But I feel like our survey as it stands right now, we grapple with it all the time because I feel like we're educating people about what it is at the same time as we're asking them questions about what they know. And so it's tricky.
So I just want to go back to a couple earlier questions for Kristen. One was whether you're able to disaggregate results by race. And second is, what can you say about the representativeness of your sample compared to the general population of, say, retail workers, et cetera?
Sure. So those two questions are actually kind of linked, because the two ways that we know our survey sample skews are we get too many women and we get too many white non-Hispanic respondents relative to what we know about the population of service sector workers. So those kinds of biases in our sample we can adjust for using post-stratification weighting. And so we do a lot of behind the scenes work to think about who should we be weighting this population up to. So we take all those steps. The things that we can't address are if there's some bias on unobserved characteristics, then our sample is not a probability sample. So we always have to have that caveat there. In all of the validation work we've done so far, things have been reassuring and have mostly checked out as we've benchmarked against probability samples. But with this new shock and this transformed landscape, we are thinking through how we may overrepresent furloughed or laid off workers who have much more time on their hands. I think many of us are spending more time online than we would when we were going into work. So I think that there are some new considerations. And so for that reason, we're not going to use our survey to try to say something definitive about the prevalence of furloughs or layoffs. But what we can do and what we can say with more confidence is for workers who have these experiences, here are the economic hardships they're experiencing. And so I think we're on firmer ground when we're looking at the relationships.
Good, thank you.
And you had asked whether we can disaggregate by race, and yes, we can.
Great. So a couple more questions at the bottom of the chat. For Lia, a question: do you believe that EITC expansion should be extended to the undocumented population? And
yeah.
Also,
yes.
the same person asked if undergrads can get involved with your project, and that's probably true for all.
Absolutely
for all three of
true.
You.
Please email me and we can talk about that.
Okay, great. Then there's another question. Are there any questions related to remittances or concerns from migrants' families back home? Julie, that would be.
Andrea, thank you. I just texted our staff and Brenda to say we forgot to include that. We have lots of information from the past about who has cross-border ties and who's sending money home, and it was an oversight. So yay, that's why we do these presentations. Thank you.
Great. Lia, I have a question for you. You're talking with, say, WIC and Head Start for help in sampling. Is there any way of working with them to be able to characterize who the people are that are going to be newly getting onto these programs as a way to learn more about them? Do you have any ins to be able to?
Well, I wonder, is Wendy still, Wendy has worked with WIC for many years. I wonder, Wendy, if you are on, if you could answer that question.
Yes, I'm here. It's a great question. And one of the things that's been really hard actually working with the agencies right now is all the service providers are so overwhelmed with everything happening and trying to transition their own services that really figuring out details with them of how to capture the data is a little challenging, but it's a great question in terms of, and we can certainly include asking people for how long they've been accessing the benefits. If we're recruiting from WIC or Head Start or anything. Head Start will actually be much harder to have additional caseload come on board. There's not a lot of room there for new people who become eligible. But for sure for WIC and SNAP and all the other programs, there's tremendous growth right now. And so Lia, I think it's a really good point, because I don't think we have asked when people start accessing the benefits, and we should definitely be capturing.
Yeah, that's a good, right. And that's great. And Wendy has a lot of connections with the California WIC and SNAP. So I think that we'll be able to. That's a great suggestion, Will.
Great. Well, we are just about at 1:10. There's one last question for Josh that I'll relate to the group. These projects are talking about the impacts of the epidemic, which is absolutely appropriate, but can we also think about how the epidemic is creating new types of sort of natural experiments that will allow us to get at underlying causal mechanisms for, again, evergreen questions that we've already been interested in, but this gives us new purchase for getting at those. And I think that's a great question for all of us to be thinking deeply about.
Yeah, I mean, inevitably, that's what we're going to be thinking from that angle as well, Josh. And that's what happened with the incoming Trump administration and the increase in negative rhetoric around immigration policy. Sadly, we had a natural experiment, and we were able to look at our measures that we look at over time and see how those were impacted by that transition.
That's a good point to think about, absolutely, whether or not we would be able to use this as a natural experiment. And I know that we're out of time, so I don't have a great answer right now, but it's certainly worth pondering. I don't know if Rita, do you have a response to that? I thought maybe you were working on something looking at a natural experiment. I'm not sure if you are still on the phone.
Not for COVID-19. Obviously, like, it's good to keep thinking about. I think the only other work I have on this right now is just trying to understand the prevalence in different socioeconomic groups. But I agree, there's good potential there, but I haven't had time to think about it.
Yeah, thanks, Rita.
Great. So it's
I'll just say brief. Oh, sorry.
No, go ahead. Please.
The SHIFT project really set up our data collection to capitalize on natural experiments, and we imagined that they wouldn't be quite so dramatic. And so we study things like a local labor policy change. But because we have national data at a large enough scale that we can characterize cities, states, and companies, it gives us a lot of opportunity to do this comparing and contrasting that you do in a natural experiment, where the shock impacts some groups much more than others. So there's really going to be no shortage of opportunities to do that. And going back to Will's question before about our appetite for having more collaborators, there's plenty to do for all of us here. So that natural experiment idea it's a terrible time, but a rich research opportunity.
Great. I don't see any of your questions in chat. I may have missed some. If anyone doesn't have access to the chat feature and wanted to just jump in orally.
One thing that I just want to call out, Brenda just said that ECHO has developed some questions. So I don't know if anybody's doing work either on the line or either of you, though, that have to do with children development, those kinds of things. And so that might be a good way to get some measures that are more universal, to your point, Will, out there. And we have access to those if anybody would like us to send them to you.
Fabulous. All right.
Thanks,
well,
Julie.
I think that we ought to wrap up right now. If anyone here has ideas for future brown bags, please send them to Josh, send them to myself and others. So stay safe and healthy, everyone. Sorry we're not seeing you all in person, but it's so good to see all of you joining. I saw upwards of 55 people at one point on this, so it's great. There's so much interest and so much great research activity. So thank you again to all three of you, Kristen, Julie, Lia, and all of your collaborators.
Thanks, Will.
Thank you.
Thank you.
Virtual
And
class.
thank you, Will. This is Josh. Thank you, Will, for leading the discussion today and organizing such a great panel. Really appreciate it.
Absolutely.